If you've ever dealt with getting prior authorization for Rexulti, you know it's not easy. Whether you're a doctor buried in paperwork or a caregiver supporting a loved one, it can be exhausting. But don't worry. You're not alone, and it doesn't have to be overwhelming. Let's break it down step by step to make it easier. First, why does Rexulti need prior authorization? It's a specialty medication used for conditions like depression and schizophrenia. Since it's expensive, insurance companies require proof that it's necessary. They may ask if other, less expensive treatments were tried first. They also want to ensure the prescription fits Rexulti's approved uses, like for depression or schizophrenia. Start by reviewing the patient's insurance plan. Check the formulary to confirm Rexulti is covered. Look for rules, like needing to try other medications first, which is called step therapy. Knowing these details ahead of time can save you delays later. Next, gather the paperwork you'll need. Insurers want detailed information to approve the request. This includes the patient's diagnosis, their treatment history, and prescriber notes. Be as thorough as possible. Include details like the length of time on previous medications, dosages, and why they didn't work. Then, get the correct prior authorization form. Each insurance company has its own form, usually available on their website or through their pharmacy benefits manager. Make sure you're using the latest version. Insurers frequently update their forms. Filling out and submitting the request can be time-consuming. This is where outsourcing services like Staffingly can be a game-changer. Staffingly specializes in handling prior authorizations, insurance verifications, and other administrative tasks. They save time and reduce the hassle, so providers can focus on delivering care. When submitting, double-check that the form is complete and attach all the required documents. Insurers usually accept submissions online, by fax, or by mail. Always keep a copy for your records in case you need to reference it later. After submitting, follow up with the insurance company. It typically takes 3 to 10 business days to process prior authorizations. However, delays are common, so a quick call to confirm receipt can help avoid unnecessary waiting. If the request is denied, don't worry. This happens more often than you might think, and most denials can be appealed. Review the denial letter carefully to understand why it was rejected. Provide additional documentation or clarification in your appeal. In many cases, this is enough to get the request approved. If the cost of Rexulti is a concern, patient assistance programs may help. The manufacturer offers programs to reduce out-of-pocket expenses. Check their website for more information. The bottom line is that prior authorizations can feel overwhelming, but they're manageable with preparation. Double-check insurance requirements and gather the right documents. If there's a denial, don't give up, appeals can work. And if the process is still taking up too much of your time, Staffingly can help. They manage prior authorizations, reduce staffing costs by up to 70%, and provide 24/7 support. With their expertise, you can save time and focus on what matters most, caring for your patients. At the end of the day, prior authorizations are just one part of the healthcare puzzle. With the right preparation and support, you've got this.
If you are looking for outsourcing services, schedule a demo today by visiting www.staffingly.com or emailing us at support@staffingly.com or call us on the number 1-800-489-5877.